Hi guys, have you heard about toilet infections? I'm sure you have, but what do they really mean? In my work, I encounter people with toilet infections quite a lot. But just wait a minute, toilet infections are not really a medical term. So what is it that you mean when you say toilet infections? And how can you deal with this problem? Well, stay tuned till the end of this video where I discuss the conditions and share some tips that could help prevent the problem. Hey everybody, welcome back to my channel. I'm Dr. Sylvia and this is Ask Away Health, where we provide you with direction and clarity about everything medical. Please subscribe to the channel, and when you do, don't forget to click the notification bell so that every time we publish a new video, which tends to be once a week on Saturdays, you'll be the first to know about it. Okay, so as a lady, you may complain about toilet infections, and when you do, you're probably describing a set of symptoms affecting the genital area which you think you've contracted or picked up from using a toilet, a public toilet or a dirty toilet. But are you right in making that assumption? First, let's look at the symptoms that women like yourself might present or come to a doctor with and describe as toilet infection. So first, there might be burning or pain during urination. You might describe itching around the vulva or your vagina. You may also complain of an unpleasant or foul odor coming away from your private parts. You could experience pain during sexual intercourse. And another symptom you might have is vaginal bleeding or spotting that is outside of your normal menstrual period. In addition to that, there might be an abnormal, unusual discharge from your vagina or private parts. It could be a very large amount of discharge that could be smelly and could be an unusual color. So these set of symptoms are what you would describe when you have an irritation or an infection within the vulva or vagina. And of course, they might also happen because you have an infection higher up, so that is within the womb, the cervix, or within the body of the womb itself. Now, do they come from using a dirty toilet? No. But don't get me wrong, of course there are a few problems that you can develop from using a dirty toilet or not practicing proper hygiene when you go to use the toilet. For instance, infections could pass into your body from germs along the toilet seat very easily if you have a wound along the skin of your thighs or your bottom, or if you have a cut in those areas. Infections like skin infections could be picked up from using dirty or unclean toilets. The other way that you are most likely to pick up a toilet infection is from failure to practice proper hand hygiene. What does that mean? So this is failing to wash your hands thoroughly after using toilet facilities, because, as you probably know, germs that cause infection linger on different parts of the toilet, including the seats, including the toilet flush handles, the taps, of the sink, the doors. So you really need, after using the toilet, to wash your hands thoroughly and be careful when you're using the toilet, because not washing your hands means that you can transfer germs from those fomites from your hands to your face, to your mouth, and into the body, and so contract infections such as diarrhea and vomiting infections that could happen in cases of gastroenteritis from food poisoning. So yes, dirty toilets do have their own place for causing problems in our health. But let's go back to today's topic, which is the so-called toilet infections. Now, we have established exactly what these symptoms that you may develop and refer to as toilet infections. And I want to look at some possible causes for these problems. Number one, infections of the vulva or vagina or the womb, as I've said before. So in other words, infections of the reproductive tract in the woman. These infections can be sexual, that is sexually transmitted infections, or they could be non-sexual. Please remember, poor personal hygiene creates an environment that enables bad germs, bacteria to grow in the vaginal or in the genital area and cause infection. Now, this can happen when the genital area is not kept clean on a regular basis, or when you wear clothing or underwear that is very tight and uncomfortable. This increases the chance of bad bacteria or germs developing and thriving in your genital areas. It It can contribute to bacterial infections or infections like thrush in some cases. Now, sexual infections, on the other hand, require sexual contact. In this video, the intention is not to go into any great detail specifically about sexually transmitted infections, but unprotected sexual intercourse can lead to conditions like gonorrhea, syphilis, chlamydia, trichomonas, herpes, genital warts. There's a whole long list of them, and they can contribute to those symptoms that we described at the beginning. So really, when you think about it and you're describing toilet infections, one of the causes that we must attribute is the possibility of infections that are sexual or non-sexual. Okay. Reason number 2 could happen when you have a skin reaction or your skin is sensitive to chemicals within skincare products or beauty products that you use on a regular basis. For example, your creams, your soaps and fragrances, your deodorants. You get what I mean? Some people can be sensitive to these and cause irritation that can lead to burning sensations or rashes or different types of discomfort within the vulva and vaginal area that you could attribute to a toilet infection. And the third reason is when people have skin problems such as eczema or other skin conditions that can contribute towards the development of such symptoms. When somebody has eczema, the skin can be very dry, which increases the risk of itching and discomfort. So dry skin within the genital area can contribute to those feelings or those conditions that make you think that you have a toilet infection. And lastly, another cause I'd like to look at today is from hormones, hormonal causes. Now, this can be as a result of the menopause, or it could be as a result of hormonal changes that happen because of certain medicines that you're taking. An example of this is for women who use some contraceptive medicines. So what this is that the hormone changes that arise from menopause or from using certain tablets like the pill can lead to changes of the vaginal tissue, which makes it more likely to get inflamed or irritated. Now, here's another thing. You might already know this, but the environment within a woman's vagina is naturally acidic. We refer to this as the pH of the vagina. The reason for this is that it's simply the body's way of ensuring that the vagina is clean and reducing the growth of bad germs within the vagina. But in some women, this pH of the vagina, which is acidic, may change, and these conditions could happen, for example, during a woman's menstrual period, from taking prescribed oral antibiotics, from overwashing the vagina, from using devices like the intrauterine coil device for contraception. It can also be an effect of semen within the vagina if you have unprotected sexual intercourse. Now, what happens when the pH of the vagina changes from what it's normally supposed to be? In some women, it makes it possible for those germs I talked about to now overgrow and lead to certain conditions. So this is why a woman might develop a condition called bacterial vaginosis, or BV, where she might experience very large amounts of abnormal discharge that usually has a strange, abnormal, offensive odor, or a strange offensive odor from the private parts. And these are some of the causes that might result in an infection like this. In addition, changes in the pH might also lead some women to develop thrush after they've taken a prescribed course of antibiotics. Okay, ladies, whatever you want to call them, toilet infection or otherwise, we have to agree that they can be very uncomfortable, frustrating, embarrassing, difficult to discuss, could hamper your sexual relationship, and so on and so forth. So it's important that we know what we're talking about and what we're dealing with. I'm going to go through some tips that I think would help individuals or ladies who might experience trouble with these symptoms to help manage or control them better. So here's my first of 10 proven ways that you can control toilet infections. Number 1, you guessed it, practice safer sex. Wearing a condom during sexual intercourse does prevent your risk of contracting or developing a sexually transmitted infection. Let's leave it there. Tip number 2, consider changing your underwear material, the fabric. We've talked about skin sensitivity. Some women could actually be sensitive to certain types of fabric, and so they should instead wear fabric that's breathable directly against the skin, particularly in the genital area. A common example is cotton, because we know that briefs or undies made from breathable cotton material are less associated with vulval or vaginal irritation. My tip number 3, avoid wearing tight-fitting clothing or underwear, particularly for prolonged periods. And tip number 4, avoid those so-called vaginal washes and douches and cleansers and whatever else you want to call them. Remember, we talked about how the body keeps the vaginal pH at a particular level where it's acidic. Well, using these washes and douches and cleansers and washing in the vagina can change this vaginal pH, can affect it. And so when you think you're trying to get yourself all clean, you're actually getting rid of the protection that your body has naturally devised and increasing the risk of sustaining some of these infections, because the bad germs are now able to thrive better in the environment that you unknowingly have created with those vaginal cleansers and what have you. Okay, nearly halfway there. Here's tip number 5. Treat skin conditions, for example, eczema, very quickly. The thing about dry skin that happens, for example, from eczema is that it increases your susceptibility of your skin towards infection. So when you keep scratching away at yourself, it breaks the skin, and once the skin barrier is broken, the bad germs get into the body or get into the vulva or vagina, causing infection. There is also a condition known as lichen sclerosis. Now, this condition is more common in women who are older and around menopause or after menopause, where the skin around the genital areas becomes more pale or whitish and is intensely itchy. Now, you know, we talked about how embarrassing these symptoms can be to discuss with a doctor, but please, if you experience symptoms like this, really uncomfortable itching, please seek medical attention. And let's not forget other ladies that might be very sensitive to different cosmetics or fragrances, fragrance toilet wipes or tissues and wash powders or laundry powders, etc. So if you identify yourself as somebody who has certain skin sensitivities, then it's important that you look out for beauty or skin treatments or products that suit your skin, and that reduces the risk of developing any of those symptoms. And tip number 6, we can't say too much about. It's practice personal hygiene. And what does this involve? Wear fresh underwear every morning and evening. If you're on your menstrual periods, change your sanitary devices regularly, frequently, especially if you bleed very heavily, in which case you should also have a bath and wash to remain fresh as often as possible. In addition to all this, avoid wearing damp clothing and damp underwear. Don't share underwear. Develop the habit of washing your genital areas, the surface of the vulva and your back, your anal areas frequently, regularly, on a daily basis, and particularly if you've been active and you've been sweating, because it's so easy for those areas, because of the way they're designed, moist areas, for bad germs to quickly begin to grow and cause problems. Here's tip number 7. Change your contraceptive medication. For some of us ladies, we may develop symptoms like vaginal spotting or bleeding episodes happening in between your periods as a result of the nature of the effect of the contraceptive tablet that we're taking. Well, not just tablet, contraceptive hormone that we're taking. The contraceptive method can affect your hormones, so the solution could be to change it to an alternative type, adjust the treatment, or stop it altogether if there is no other cause that's been determined. Of course, all that needs to be done under the advice of your practitioner, but it is important that as ladies, you're aware that this could be a cause or could be responsible for the symptoms that you're experiencing. Tip number 8, consider HRT, which is hormone replacement therapy, and of course this applies to ladies around the menopause. So let me tell you what happens. Around the time of the menopause, your estrogen levels are going to go down. Now, estrogen is one of those hormones that's responsible for maintaining the vagina, maintaining the tissue, the cells of the vagina, even the lubrication of the vagina. Because this estrogen level drops, the vagina becomes more prone to irritation. The tissues and the skin of the vagina is more dry. An irritated or sore and dry vagina can lead to painful sexual intercourse. It's not the toilet infection, it's the drop in the hormone level. So for women who want to use it, HRT has been found to improve the moisturization of the skin of the vagina and reduce the chance of painful sexual intercourse in those cases. There are also a range of alternatives to HRT for this purpose. So the message is, if you're experiencing this vaginal irritation or having trouble with painful intercourse, please speak to your physician, because like I said, HRT or alternatives are options that could be considered depending on your medical history and background, whichever is suitable for you. So it is worthwhile having that discussion. And tip number 9, maintain a healthy immune system. This is so important. As we all know, if your immune system is weak, you are at a risk of infections. But in your vagina, there is usually a mix of different germs, and they generally do not cause any problem because your body's immune system plus other things like the acidic nature of the vagina, which help to keep their growth under control. But if a person has a weakened immune system, even the so-called good germs now begin to grow and grow in excessive quantities to cause problems. And so, for example, in people with low immune system, they could easily develop thrush, which wouldn't have happened if their immune system was functioning and healthy. And the last but not the least tip I have in today's session is, don't take antibiotics unless you're prescribed them, and only use them for the period for which you're supposed to use them. Now, why do I say this? Antibiotics are drugs which kill harmful bacteria. When you're prescribed the course of antibiotics, we expect it to go ahead and kill whatever bad germs or bad bacteria that are causing the problems in your body. But did you know that in addition, they could also affect the good germs or good bacteria that your body coexists with to function well? And what happens in that stage? But why do I need harmless bacteria or good bacteria? I can hear you asking. Well, harmless bacteria are actually helpful in keeping the levels of other bacteria low in the vagina. So these are the sort of strategies that your body has in place to keep you healthy, in addition to things like the acidic nature of the vagina, which we've already discussed earlier in this video. So after a lady has taken her prescribed course of antibiotics, it will have dealt with the bacteria for which she was given the medicine, but it might also kill off some of the other good germs that the body actually requires. And when this happens, other germs take advantage and overgrow. A very good example of this is yeast. And this is why some women, not all, but some women can be at risk of developing an infection of thrush just after they've completed taking antibiotics. And lo and behold, they might think, oh, it's because I used this toilet the other day. But this is the reason why it might happen for some women. All right, my dear ladies, if you do develop symptoms of vaginal or vulvar irritation and infection, you can see that there are quite a number of causes that have nothing to do with the toilet. So my advice is, please seek medical attention quickly if it's something that you're just not familiar with, so you can get the right diagnosis and get the right treatment, because you will also see that there are different treatments depending on whatever is responsible for the symptoms. Okay, so that's all I have for now on this particular topic. If you found this useful, please let me know in the comments. I do read all my comments, and I do try to respond to as many of them as possible. And if you have found it useful, please share with a friend or sister or somebody else that you might think would also benefit from watching the video as well. Let me know if you have any questions in the comments, or drop an email to info@askawayhealth.com. www.immune-support.org. And if you're looking for tips on how to help improve your immune system, please check out this video here, and I'm also going to put a link in the descriptions below. And if you are interested in fibroids, I've got a great playlist full of videos on causes, the types, symptoms of fibroids, and different treatments available. I will put a link for that in the description below as well, so please make sure you check that out. Finally, if this is the first time you've come across one of my videos, thank you so much for watching. Don't forget to subscribe to the channel and click the bell. Please put a like on it as well. All the support encourages us to make more videos like this. So stay well, and I will see you again soon.